I have started your time. One more page.
Okay, ma'am. Next page, ma'am. First page, ma'am. Just a, yes.
Okay.
Okay, ma'am.
Yeah. So this is structure discussion.
Yes, ma'am. Shall I start?
Yeah. Started your time.
Okay, ma'am. Hello, I'm Shashi, one of the exam candidate. I have read my case scenario and I'm ready for the case-based discussion.
Okay. So after going through this case,
Hmm.
what information will you seek uh, before discussing the contraception?
Yeah, I can see that my patient is a 18-year-old girl, and it has been mentioned here that she is having learning disabilities, and her background is that she is having learning disabilities, and she is coming here for contraception, and that to be she is accompanied by some of his caregiver. So I will first of all I would like to assess her. I would like to assess her mental capacity, and also I would like to know whether she has been assessed by any psychiatrist, or if it is not there, I will need to assess her, and then I will recommend what kind of contraception has to be given.
Okay. So what information you would like to know?
Yeah, so I can see that she is 18-year-old girl and she is accompanied by a caregiver. So I need to take a focused history about her periods, about her mental ability, and also I need to know right now what is her requirement. So first of all, I need to assess her mental capacity, and then I will like to know if the caregiver has got this authority to talk about her or not, and then I need to know whether this girl is requiring this contraception herself, or if the caregiver is involved in this, or I would like to know what can be the reason behind this requirement, if she is already sexually active, if she is using any contraception, and then after I need to know about her periods, and yeah, and also I need to know whether she is involved somewhere, whether there is any sexual abuse, and then after I would like to know about her periods. Like in the period, first of all I need to know when was her last period, if her period is regular, if she is capable of managing her periods, and also I need to rule out if she is pregnant. Then after I will like to go to know if she has been ever treated for any sexually shared disease, and Then, along with that, we need to check whether she is having any medical concern, any problem of BP problem, diabetes problem, or any thrombosis problem, and need to check whether any family concern is over there. If anyone from her family is there, if any idea of any concern, and apart from that, I need to know about any surgery on your abdomen or vagina, and also I will check what blood group she is having and how much is her weight to height ratio, and I will rule out if she is having any allergy. And then I need to know if this girl is like any if she is using any kind of any smoking, any alcohol, or any drug abuse is there, and how is support around her, like where she is staying, where she is living. We need to know everything about her, and gradually, before giving any kind of contraception, I need to know, I would like to get assessment for her mental capacity, and that to be as I told already, that will do either by psychologist or psychiatrist, will involve them, and her care has to be given here, will involve here team of the MDT, will involve the psychologist and counselor also. We can take help from the counselor.
Okay. So what will be the basis for offering a contraception in this girl who is lacking, means who is lacking mental capacity?
Uh, yes, I can. First of all, I need to assess what kind of requirement she is having. In that, we'll have to check whether how's her periods. If she is having heavy period, in that condition, we'll have to go for those kind of contraceptions who will limit her bleeding. Then we'll have to also check whether she can manage any contraceptions or not. Like if we are providing any pills in that condition, we need to check whether we need to check if she will be keep will be regular in the pill intake or not. And then after also we need to find out if she is having any kind of infection from the vagina, or any sexually shared infections, or if she is already taking any contraception. In that condition, we'll have to assess if it suits her, then we can continue, and that's all we'll do here.
Okay. What steps will you take to ensure that what kind of contraception you will be offering her?
Yes, for that, as we are assessing her on the basis of medical capacity, so first of all, we need to assess her capacity, and we can involve here if either since we are not sure that the this caregiver has actually he has right things, and he is involved over there or not. So we need to check here that whether he has got any legal approval. So we need to assess this contraception advice has to be given on that basis. Like we are having multiple options of contraception. We can go for pills. We can go for any long acting reversible contraceptions. Like we can go to advise her intrauterine devices. We can provide her implant, and also we can provide her this injectables in her case. So we'll have to check that if she is having any problem related with her periods. According to that, we'll have to decide this. Uh, and also there are further contraception advices, like permanent methods are there, sterilization methods. So we cannot go for those. We'll have to assess the patient. Since she is not mentally capable, and she what we can expect here, that she won't be able to handle everything. So we can provide her those kind of those kind of contraceptions in which will be she will have to manage less. So we can offer her this long acting reversible contraceptions, and in that we can offer her intrauterine devices. And in intrauterine devices, if we are providing copper T, copper devices, in that there may be irregularity of the bleeding, and also there may be pain. So it may be not manageable by the patient. So we can think of hormone containing devices like LNG IUD. With this, there will be benefit of patient will be in amenorrhea, so it will be manageable. And also we are having other options like implants and injectables, but in these also there are risk of bleeding in between. And for the injectables, she will have to come again and again. And other side effect is that since she is 18 years old, so there will be risk of decrease in her this BMI. She will have a risk of osteoporosis, there is some association with bone demineralization. So I would like to prefer for this LNG IUD, and otherwise we'll have to will check what are the other things which for which we can think to provide the contraceptions. Like it will be on the basis of her presentation, will offer her contraception.
Okay. Uh, if the patient is competent, how you are going to approach regarding the discussion of contraception in this case? So the question what I wanted to ask, you had already answered me in the question number 3. And
Mm-hmm.
time is also up now. Okay.
Okay.
Okay. So my last question was, if found competent, what will be your approach regarding discussing her contraception?
If she will be competent, then first of all, we'll ask her that what kind of requirement she is having. If she is if she wants long-term contraception, or if she wants to go for the just she has a requirement of any shorter duration. If she wants to control along with this contraception, if she needs any regularization of her periods. And also we need to know if she wants this permanent
Completed.
structure.
Completed.
Yeah.
Yeah. 10 minutes. Okay. So now your own feedback.
Very.
Whoever wants to give a feedback are welcome, and then I will discuss my feedback and our answer key.
Ma'am, I was not prepared, so I don't know. I was thinking I'm going here and there.
Okay. Anybody else wanted to comment on her performance? Nobody. Okay. Uh, this is one of the means what I will feel hot topic. This used to be a very hot topic when there was a previous format of part 3 MRCOG exam. Means it was in the era when it was this there was only part 1 and part 2 of MRCOG.
Okay.
Okay. Yeah. So this is learning disability. A mother wanted to discuss the contraceptions. Okay. Then there is another topic, something like angry mother, who wanted to discuss why you had prescribed contraception to a teenager daughter. So these are two, three stations which used to be very important at that time in 2014, 15, 16, something like that. Before 2018, means 2017, 2018, when they had changed this format to part 3 MRCOG. So do not take this topic very lightly. There is a very good talk available regarding this menstrual irregularities in a adolescent woman or girl with learning disability, something like that. A talk is also there. Very nicely given what exactly you need to counsel and how to counsel. Okay, some knowledge part is there. You do not need that much knowledge part here, but yes, a basic important steps is very important here. The first question actually what we had discussed, simultaneously can we go through the answer key also so that you will know what exactly you had missed out. Okay.
Yes, ma'am.
Hello. Yeah. So this is my first question. S bar, very nicely you used your S bar. That a case of, you had mentioned a 18-year girl, but I had directly mentioned a case of learning disability for contraception. As per caregiver, she needs assessment, and if found competent, then contraceptives of suitable choice with involvement of safeguarding team, because we do not know whether there are any issues regarding safeguarding also. Hmm?
Yes, I
as
forgot
you,
to.
as yeah, as you rightly mentioned about abuse, but involvement of safeguarding team is also important here.
Yes, ma'am.
If
Yes.
it, yeah. So now here what you meant, what things you had made, you started answering in the beginning only all the points, and then you started elaborating in between. Go systematically in structured discussion. So what information you wanted to know? Now coming to a learning disability, so you definitely wanted to know about learning disability, what kind of learning disability the patient is having, and how severe it is, means whether she is able to take care of herself, or whether she is able to means take a decision for herself. That means a mental capacity assessment. That means we are going to communicate, convey the information. The information needs to be grasped by the role player or a person, and she needs to communicate back with the right decision. That decision might be anything, but she needs to take a decision. So this is something like assessment of mental capacity. So here I would like to know a type of mental learning disability, a severity of learning disability, and if whether the mental capacity has been assessed or not. Here I would like to comprehend, and needs to needs to assess whether the patient understand, communicate back with decision. So this is assessment of her mental capacity, and under whose care the patient is having as per at present, who is a current caregiver, whether she is in foster care, whether she is with family. I would like to know about that also, because, and the third thing is about her contraception. Why she need? You mentioned about contraception. You wanted to know the details about contraception. Okay. So here I wanted to know why she is keen on contraception. Whether it is her choice or it is a choice of any caregiver, as these patients who are having a learning disabilities are at risk, increased risk of sexual abuse. So I wanted to know why. So we had completed in this first 2 3 points: learning disability, caregiver, assessment of mental capacity, self. Initially, I will be doing. If not, then I may take a help of consultant or the expert opinion, which will be mental this mental health specialist. Okay, they will be helping us. Why the request of contraception for her from herself or her caregiver? Because I need to rule out whether there is any history of abuse or any signs of abuse. Along with that, I wanted to know about her sexual history. You mentioned about sexual history. Mm, Sexual history, basically, what sexual history you wanted to know? Whether she is sexually active, any sexually tract infection, any contraception she is using, and any previous pregnancies. You mentioned all the points here. STI also you mentioned. Yes, you mentioned STI. Pregnancy also you mentioned. Contraception you also mentioned. Now coming to the menstrual complaints. So menstrual complaints you really wanted to know in this teenager or adolescent patients in detail. When was her last menstrual period? What are her cycles? Whether they're regular, irregular, heavy, painful. Because a choice of contraception will allow me to manage her menstrual complaints also. So it is very important to know her menstrual cycle. And then the risk assessment. Here, risk assessment, that means whether they are having any medical comorbidities, any surgical comorbidities, any contraindications to what? Any contraindications to pills or hormonal contraception. Something like any family history of thromboembolism, diabetic, hypertension, BP and diabetes. Why BP? Why diabetes? Okay. So here you used blood pressure, diabetes. So no, this is a structured discussion. We have to use a medical language. No lay language will be used here. You have to make yourself to that extent. You have to practice to that extent that if it is a structured discussion, then no BP. You have to say hypertension. Diabetes, Family support, yes, very nicely you had asked with whom she is staying, what support she is having. Then a learning disability girls are less likely at risk of smoking, alcohol, drug addicts. Okay. Uh, Drug addicts still I will think, okay, if they are in a bad company, but smoking and alcohol less likely. It's okay. You can just one word only you can say. Here I would like to take a social history regarding her support, regarding her caregiver, regarding her social habits like smoking, alcohol, and drug abuse. So, social history. You include all these points into her social history and no need of blood group. Why you wanted to know a blood group in this case?
I'm just
BMI allergy. Yeah,
just
BMI allergy is very important because we are going to prescribe a contraceptive method. So, BMI and allergy is very important, but no need of blood group. Okay. Once the risk assessment has been completed, you need to offer examination because you wanted to know her BMI, you wanted to know her blood pressure, and also mental capacity, MCA. This information I wanted to know regarding this patient. Okay, so this is your information. Most of the points you had mentioned here, one or two points which has been missed out, and try to be more structured so that you will score more, dear. Then the next question, I think it was googly for you. You didn't understand and you repeated the information what we had discussed in the first question. Many a times this kind of things happen in the real exam also. You keep on uttering the same information. If you didn't understand the question? Okay. So what will be the basis for offering contraception? So basis basically, if the patient is competent, then definitely the patient is having autonomy. Okay, we are going to respect the patient. There is autonomy. But what if the patient is not competent, or she lacks capacity, then it will be in the best interest of the patient, because these patients are at risk of sexual abuse, unwanted pregnancies, and sexually transmitted infections. Along with that, if there are any menstrual abnormalities, then those will also be taken care. So aim of the prescription will be regularization of menses, prevention of sexually transmitted infection, and unwanted pregnancy. So this will be a aim. If found competent, it will be autonomy of a patient. If found incompetent, okay, then it will be in the best interest of the patient. Remember these two things. Now, what steps will you take to ensure that you are able to offer her contraception if patient is not competent? Okay, so if the patient is not competent, then here first we will be assessing a mental capacity by the expert. Hmm? Once the patient is deemed incompetent, then it will be a best interest meeting. So what is best interest meeting? Here a caregiver, a consultant who will be managing this case, along with mental health specialist, will be a part of this team, and the best possible treatment choice will be offered to the patient. So that is a decision by the consultant here. So the consultant, it's consultant's legal duty to consult and arrange a range of people who will be uh, determining the best interest of a patient. Okay, so the people who can who are taking a good care of the patient, involving those patients relatives, or a caregiver, a mental health specialist, and the consultant. So this and the consultant will be taking a best interest decision. If not possible, or if not possible here, then comes the legal guardian, where a legal guardian will be there, who will be, even legal guardian will come prior to best interest. If the legal guardian is there, then it will be a legal guardian followed by best interest principle, and if not, then it will be a legal decision. Legal decision basically, we have to go to the court and take a court appointed deputy who will be deciding what she can do here. The decision will be also involving a senior colleague, especially from the family planning consultant, because it is very important, because this kind of patients are very less likely we will able to manage. So here need of a senior consultant or a family planning physician is important. It will be a multidisciplinary action activities which will include physician, GP, social worker, caregiver, including mental health specialist. Safeguarding team, if at all you are thinking that this patient is at risk of any abuse, then definitely you are going to involve a safeguarding team also. So these steps will be taken to ensure that the patient will be offered a contraception. And the last question, what you had answered very nicely, is what will be the options if you will you consider if the patient is competent. So if the patient is competent, then we will discuss the variety of options available. Here you have to go systematically. For that, I will definitely suggest you people to go and read that talk, since you are having plenty of time at present. The talk name is menstrual abnormalities in adolescents having a learning disability. Okay, so that talk will be available. It was a long time back talk, but it is available. So here the options will be, you have to discuss pros and cons of all the options whichever are available. So including pills, barrier contraception. Barrier contraception is very important because it prevents the STI. Okay, so that is this in teenagers or adolescent people, there is a double method. One is a barrier contraception where it will prevent a sexually transmitted infection, but it will not be preventing uh, unwanted pregnancy because the failure rate is pretty high. So it is very important to give pros and cons of all the options and discuss. LARC. LARC is what? LARC is IUD. LARC is implant. LARC is copper IUD, LNG IUD, and another one is DMPA. So these are the options. Am I audible?
Yes, ma'am.
Okay. Yeah. So these are the options. Here we are going to offer patients all the options along with her is pros and cons. Barrier contraception effective in preventing STIs, but the failure rate is very high. Act specific. Pills, the compliance, you need to remember this, but along with that, pills can also take care of other menstrual abnormalities like dysmenorrhea, heavy menstrual bleeding, and regularization of period. So those are the benefits, but compliance, sometimes a gastric side effects also there. So these are the issues associated with compliance. If the patient is having subnormal or a mild learning disability, so that compliance is an issue in this case. LARC is once a month or once in a 3 months or a long acting. Here, this is the best thing what we can offer to this patient. This can take care of her menstrual problems, her means her contraceptive need also can be taken care. Uh, the most suitable in this case, since she is a teenager or adolescent, IUD or intrauterine devices will increases the risk of STI, so should not be a first option. DMPA, bone loss, as you have rightly mentioned, okay, less than 18, there is a risk of osteoporosis, so should not be a better option, but implants can be considered in her case. Okay, depo preparation because of low BMI or the chances of having a affection on BMD, not BMI, BMD, and the last one will be implants. Okay, so implants are better option in this case. So all the options will be discussed and the more suitable options will be offered to this patient uh, after the means mutual agreement. Okay, so this way we are going to complete this task. So information gathering here is, what are the, just simply remember what is the information gathering. If I will be closing my eyes, I'm not looking at the screen. So the information gathering is about learning disability, her mental capacity, her caregiver, her need for contraception, and any comorbidities, mental or means surgical history or any social history which will interfere here. Along with this information, we would like to know her menstrual complaints because that is very important, and examination. So take a good history. Now coming to the points what had been given. Uh, Good history, rational for the request, why contraception, menstrual history, any previous contraceptive use, sexual history, and previous pregnancies. Learning disability. Okay, so how what will be the extent of her learning disability? Ascertain who is making a request for contraception, whether it is a caregiver or the patient. Any contraindications. So by means medical assessment, so and BMI, blood pressure, you are going to assess whether there are any contraindications. Offer examination and undertake any appropriate investigation in this case. So what investigation you would like to know? I will be taking, means mostly it will be if she is sexually active, I will be going for a swab, and max to max I will be going for a TBS. Okay. No other investigation I will be seeing here. Involvement of experts in assessing a mental capacity. Communication with patient and families, lies with caretaker or family on the reason behind the request. Empathy, concern, respect for caregiver, parent as well as patient. This will be applicable when it will be in a SPT. Huh? It will not be in this case. Clearly explain the process of deciding choice of contraception to patient and caregiver or parent. If it comes as a SPT, in the beginning only you are going to ask, do you means who is a legal guardian? Okay, legal guardian. And most of the time, if the parents are legal guardian, then that best interest part doesn't come up. Okay, that then best interest part doesn't come up. It will be only a legal guardian, because they will decide. And if at all no legal guardian thing is there, then in that case we have to just say this best interest. Always remember this. Okay, if it comes in SPT, best interest will not be an issue. I mean, best interest will not apply here. Patient safety, discuss the side effects of the various options. No contraindications to choose and method. Demonstrate the understanding of safe prescription relation to drug interaction. Uh, a certain drug allergy and allow safe prescription. Along with this, assessment of mental capacity is very, very important, because without capacity, we cannot discuss the options with the patient. The second is patient abuse, sexual abuse, okay, and safeguarding team. That is also important patient safety points in this case. Nice guideline on LARC. Demonstrate an understanding of UK MEC. Familiar with Mental Health Act capacity for treatment, that is informed consent, and demonstrate familiarity with current literature on the treatment of women with learning disability. Okay, so this is what about this task. Anybody is having any question? No? Shall I end here? Means stop recording. We will be going to the next topic. Okay.